By the spring of 2020, I became the sickest I had ever been, experiencing symptoms from chronic widespread pain to burning sensations in my arms and legs, as if barbed wire had been wrapped around them, and even migraines and vision loss. Beyond that, my health continued to overall deteriorate, and fatigue and cognitive dysfunction overtook my body. Over the course of multiple months, my physicians ran different imaging and blood tests to rule out any autoimmune or degenerative neuropathic conditions causing the pain and other symptoms that were quite concerning. Throughout this process, I was drugged and put to sleep multiple times under general and local anesthetics, sedatives, narcotics. It took a toll on my body beyond anything I could ever imagine. By December of 2020, I had had multiple procedures and imaging to understand the source of my symptoms without any reconciliation of the problems and the causes of those problems. There came a point where I could no longer walk and my legs were turning purple. Over the course of this year that my physicians took to try to find a diagnosis and a cause for the symptoms I was having, they began treating the symptoms as they were. So they put me on a series of medications on a trial and error basis. I was put on Lyrica and gabapentin and Xanax and tizanidine and tramadol and Celebrex, naproxen. The highest, I was maxed out at some point on all of these medications where I was getting regular blood work done because it was affecting my liver. It's funny how we treat chronic pain patients in a way that's pretty alarming. Because the reason that we treat these patients is to give them an increased quality of life. However, with the medications that we give them, sometimes it demeans and makes their quality of life quite worse. There's a staggering correlation between the amount of medications given to patients and the tendency to overuse or misuse the medication. It's important to note that a lot of patients with chronic pain sometimes self-medicate beyond what's prescribed. This can obviously lead to misuse of drugs and a cycle of dependency on these drugs. A clear difference of your healthy brain and your brain on addiction, either drugs like hard drugs like cocaine and heroin. There's a decreased metabolism, and specifically in brain metabolism in drug addicts. And we see this in the way that they become slower and sluggish and exhausted and cognitively dysfunctional. This is also seen in patients who are hopped up on multiple medications for chronic pain management. It's really alarming. You can see in different examples where drug users and non-drug users have different brain mechanics and ability to use their cognitive abilities. We see this in patients with chronic pain as well, because of the multitude of medications that they are on the effects it has on their organs, their brain, their cognitive functions, their ability to analyze and function as human beings. Although it treats the pain, you create a new cohort of problems for them.
Ankle strategies there. All right, let's switch feet. Let's put the right foot in front. There you go. There's that step. So recover and reset. There you go. You saved me, Natalia. Nicely done. Okay, let's turn it around.
After many months of research, I found that the best way to manage and treat my chronic pain was to approach it in a holistic way. Many months of research ultimately led me to understand and learn about nervous system regulation and the importance of your nervous system feeling safe. Ultimately, pain is a feeling of fear and a feeling of unsafety. It is nearly impossible to treat and manage chronic pain without the nervous system feeling safe. Although it depends from person to person, one of the most remarkable ways to treat chronic pain is by using movement and exercise. This increases your endorphins and oxytocin levels in the brain, which play a part in the pain signal of your brain. And it inhibits serotonin as well. A lot of the medications given to patients are serotonin inhibitors, endorphin inhibitors, and all of this can be naturally occurring if we allow it to and if we work hard to function in a way that we do not require drugs to treat patients with chronic pain.